Hello, this is Dr. Bouvier with Dr. You, and you come to this video either because Mr. Trump asked you to come into this video, or you've stumbled across this video to learn a little bit more about what should happen in healthcare reform. I'm going to give you a problem of healthcare that needs to be fixed by healthcare reform, and I'm going to give you an example of that problem. So a problem is people that are in authority making decisions that have no idea about medical, maybe a little bit, but it doesn't translate to the one-on-one. So I've got my patient here. Say hello.
Hello.
And it's okay to put this up on YouTube, right?
Right.
Okay. So she's had one of the most difficult cardiovascular situations ever. It's taken us years really to get this blood pressure with a good team of doctors, spending tens of thousands of dollars.
I finally feel good about myself.
Good. Having saved literally millions of dollars in care and her life. And now we have bureaucrats telling her that she has to change her medications because it's not on formulary, or they want to charge her $300 prescription. Maybe one or two people that you know personally that can afford that. Well, Mr. Trump, maybe you do, but she doesn't.
I can't afford it.
So, what do you think the problem is here?
I think the problem is they should ask the public themselves that are having problems with their health, and also get somebody in there get input from your doctors. All these doctors have ideas. You can filter them out, but you can at least get an idea of what the problem is.
So you told me a little while ago, so to interrupt you, you told me a little while ago that we need to get the bureaucrats out of the business of healthcare and let the doctor-patient relationship drive what's most important for you.
Right, because when we started Blue Cross is run by doctors. Now it's run by CEOs that just worry about the bottom line with the money, and they don't worry about the patient. And this has been going on for about 20 years.
From the mouths of babes. I love it. Good job, girl. So,
well, it's the truth.
So here we have her medications are controlled. She's got her heart and lungs and kidneys controlled pretty good. She's been seen in Cleveland Clinic, a couple other specialists, and now we've got things pretty well controlled.
Right.
But they want to change her medications. And that's going to either kill her or going to cost healthcare literally $250,000 over the next 2 months, because she's going to end up in the hospital and ICU. I guarantee it, it's going to happen.
And actually, they should get the pharmaceutical companies to come together and figure out why this is such a costly medications for what they make and that.
No, actually, that's probably not the problem, but that's for another video.
Oh, sorry.
But we were having a conversation, and Margaret agreed that if everybody had one of these books, it's a 3-ring binder, you can go to drandyu.com, learn about a thing called The Book, quote, the book, unquote, drandyu.com, and we were talking about what this has organized her life and how it's organized her life, and we were just running the numbers from public health, and if you took 10% of the nation's population, and you had 50% of them use this book, a book like this, and took good control of it for you, their own personal book that helped doctors communicate to the numerous places you've gone, that it would improve the healthcare cost by $300 billion per year. Let me repeat that. 10%, take 10% of the population, get 40 to 50% of them to use a book like this, would save healthcare $300 billion. Mr. Trump, that's a deal you cannot say no to. So, thank you, Margaret. Thank you out there on YouTube. This is Dr. Robert Bouvier with Dr. You. Thank you very much.